And that's where we're going to begin with the news that you probably were talking about a lot this weekend, because there are a lot of unanswered questions surrounding President Trump this morning as he continues his treatment for the coronavirus. So he went for a brief ride in his motorcade outside Walter Reed Military Medical Center yesterday, just so he could wave to supporters. Now, some health experts say this outing put other people, the Secret Service agents in the SUV, at severe risk.
It is a sealed vehicle. Briefings led by the president's doctor, Sean Conley, provided little clarity. The medical team said Mr. Trump could be discharged today, even as they described treatment that is more typical for a severely affected patient. Ben Tracy is at the White House for us. Ben, good morning to you. So, simple question. Do we have an accurate picture of how the president is doing?
The answer is no, and that's because the president's doctors and White House officials have been giving conflicting and confusing information about the president's condition all weekend long. We do know the president is awake this morning. He's been tweeting about everything from the stock market to Democrats, apparently trying to show people he's just fine.
I learned a lot about COVID. I learned it by really going to school.
In a new video from his hospital suite last night, President Trump says he finally understands coronavirus, 7 months into the crisis that has killed nearly 210,000 Americans.
This is the real school. This isn't the let's read the book school. And I get it, and I understand it.
The president then got in his SUV and went out to wave to supporters gathered outside. He was wearing a mask, and the White House said the movement was cleared by its medical team. But some experts say he risked exposing his security detail to the virus.
I was trying to reflect the upbeat attitude that the
Dr. Sean Conley admitted to giving an overly optimistic view of the president's health this weekend.
it came off that we were trying to hide something, which wasn't necessarily true.
The doctors now acknowledge the president had a high fever and his oxygen level an antiviral drug. Treatments typically indicated for severely ill COVID patients. CBS News has learned President Trump was given supplemental oxygen at the White House Friday before boarding Marine One for the trip to the hospital.
Just 72 hours into the diagnosis now.
Conley also caused confusion by suggesting the president was initially diagnosed Wednesday before traveling to Minnesota for a rally and New Jersey for a fundraiser. The White House later claimed Conley misspoke. Himself.
He has mild symptoms.
Saying that Friday and then admitting the very next day that in fact the president's vital signs had been very concerning and we are still not on a clear path to a full recovery. It's still not known how or when President Trump was infected, but last weekend's packed and mostly maskless Rose Garden ceremony for
Barrett
may have been a super spreader event. Those now infected include the president, first lady, former aide Kellyanne Conway, former New Jersey Governor Chris Christie, who is hospitalized, Senators Mike Lee and Tom Tillis, as well as the president of Notre Dame. Campaign manager Bill Stepien and personal assistant Nick Luna are also infected. It's not clear what level of contact tracing is being done by the White House.
Are there any people who right now and should go get tested to make sure they're not continuing to spread it to other officials? There doesn't seem to be a very concerted effort underway.
Vice President Mike Pence tested negative for the virus again on Sunday, and he is planning to participate in the vice presidential debate on Wednesday. Now, as for President Trump, if he is brought back here to the White House, he will be able to continue his care. There is also an intensive care unit on site here, and he would remain under the supervision of his doctors. Gail.
Okay, Ben, thank you very much.